I'm Cucu Saidah, Disability Inclusion Advisor Indonesia. I'm working in the neighborhood and also would like to share briefly about the situation of the global pandemic COVID-19 in Indonesia, which has bring significant impact to the country. Up until now, it has been reported more than 6,000 people are affected, where more than 500 of them are died. The government announced numbers of policies in response to the outbreak, such as social security net, social distancing, and physical distancing, which is now being into limitations of social activities in larger areas. Although few of districts and provinces are already announced the regulation to public, many people are still having activities outside of their homes. It's there because most of them are working in the informal sectors. The situations, of course, has bigger impact to the life of people with disabilities. They became more vulnerable due to the outbreak, as further create barriers to access even their basic needs. During the outbreak, they in high risk of being left behind to access their rights, such as the right to accessible information of COVID-19, the rights of getting the social security nets from the governments or other institutions, losing their jobs, which of course this is creating problems in their daily lives. Currently, the Disabled People Organization or Organization of Persons with Disabilities throughout the country are working very hard in doing the assessment, the rapid assessment of people with disabilities and their families to getting done, and then this will use for the advocacy. CBM, in response to the outbreak, is working in partnership with the partners such as Yakum in providing health services, such as hygiene kits, working with other partners in the various working groups of the response COVID-19 at the national level, as well as encouraging the organizations of persons with disabilities in different forums, and also to identify the opportunity to build capacity of the partners, such as organizations of persons with disabilities, governments, and other humanitarian agencies to ensure disability inclusion in the outbreak response. So let's work together to combat this global pandemic.